we all right? Good morning, everyone. I'd like to call this meeting of the Cook County Public Health Human Services Board to order on this Tuesday, September 17th at 8:31 a.m. First item is the approval of the consent agenda, which includes our meeting agenda, minutes, financial report, abstracts and bills, and the hire of position for the coordinated crisis response worker. Also, there is an amendment to our agenda under staff report. We have Martina Johnson here with the Boreal Partners Transit, so I'd like to add that to the agenda. Is there anything, any other changes to the agenda or any items from the consent someone would like to pull and discuss?
Mr. Chair, I'd make a motion to approve the consent agenda as amended.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
I'll support that.
Thank you, Commissioner White. We have a motion and support. Any further discussion? Hearing or seeing none. All in favor? Aye. Opposed? Motion passes unanimously. Thank you. Well, that moves us right on down to you, Martina. Thanks for being here this morning.
Thanks for having me. Good morning.
Good morning.
I am here to talk with you today about Boreal Partners Transit. I've come before you a couple times now with some requests in regards to the project, but I've not had an opportunity to give a full presentation on what it is. So I wanted to do that today. So I am Martina Johnson. I'm the Adult and Home and Community-Based Services Supervisor with Cook County Public Health and Human Services. I am one of 3 social services supervisors within Cook County PHHS. I supervise the Adult and Home and Community-Based Services team. We serve primarily adults. We have a large population of clients who are 65 and older, but we also have some children on our caseloads. So my team consists of 5 case managers, 1 case aide, and myself. My degree, I have a Bachelor of Arts in Social Work from the University of Wisconsin-Madison. And I started with Cook County in January 2007 as an Adult Services Adult Mental Health Case Manager and was promoted to Supervisor in 2015. So I'm not quite sure when this idea, not quite sure when this idea was hatched. It was so long ago that I can't remember who thought of it, if it was me, if it was just based on a collaboration with others. It's just been something that I have been thinking about for a long time and have wanted to try to implement in Cook County. Through my work as a case manager, I learned of the difficulties many residents across the county experience in accessing transportation, especially those who live outside of the bus routes that are provided by Arrowhead Transit, are persons who are living very rurally, and those that have mobility needs. In county-based social work, when we encounter a problem, we are often tasked with finding a solution. So in my years of working with Cook County, I have been a part of several audits. They happen for our programs that we coordinate. They happen quite regularly. We have some audits that are annually and some audits that are every 4 to 5 years. One of the things that they often say when they come to see us is, we notice that you don't have this service. And in Cook County, there's quite a lot of services that we don't have right here. And they say, what are you going to do about it? And that's a big question because first and foremost, I am a supervisor and I have a team that I'm trying to support. And we have many programs that we are working to implement and many clients. But it's always kind of there in the back of your mind, like, what am I going to do about this problem that we have, and how can I be a part of the solution? So my first attempt at applying for a grant to purchase a van, because that's the big cost here, is the actual vehicle that we're using for the service. I applied for a Live Well at Home grant in 2021, and my application was not selected. So then I applied again in 2023, and that application was successful. So the problem that we are facing in Cook County, I think you all are aware of this, but just to give a summary, our county has roughly 5,600 residents, over 1,453 square miles. To access care above and beyond primary care, residents need to travel to Duluth, which is the nearest healthcare hub. The sole public transit option, Arrowhead Transit, serves the Highway 61 corridor from Schroeder to Grand Portage, as well as a 5-mile radius of Grand Marais. Hours are limited, and rides to Duluth are limited to once per week with a set schedule that makes several stops away. They're a for-profit model, so they have to provide service in a way that's going to be profitable for them. So it's understandable that their routes are limited and their hours are limited. While Arrowhead Transit does have an ADA compliant bus, it only serves those along its route. Volunteer drivers that serve the remainder of the county currently use their own vehicles, which limits their ability to serve residents with mobility issues. Specialized transportation providers outside of Cook County who serve our region are reluctant to take on transports for our residents, as it takes a driver and a shuttle off the road for an entire day, which isn't always feasible for their companies. So our solution is a standard size ADA compliant van that can be driven by anyone. You don't need a special license to drive it. It's owned and operated by Cook County and added to the county fleet, which results in a more manageable insurance and maintenance costs. There's greater flexibility in hours of operation. We are not held to a set schedule. We can try to meet the need if we have a driver available when the need is occurring. So that could be at night or on weekends. We're able to serve a larger geographic area. One of the things that was important to those of us that were planning this project was to have a vehicle that could get down roads that might not be plowed the greatest, or steep driveways, places that it would be difficult for a bus to get. We're hopeful that our van is able to get those places with some good snow tires. And those coordinating the rides are located locally. So when somebody is calling in, we live here, we know the area, we know probably the general area that they live in. Other options, they have a call center that's located in Virginia, I believe, but here you're getting someone that is based in Cook County. So we're also using volunteer driver programs that are already established in the county. So we are partnering, I'll talk more later about our partners, but we are partnering with Cook County, Care Partners of Cook County, and also the in-home support program. So we're just kind of working with existing models. Why does this matter? As we know, our local population is aging. Compared to the state of Minnesota and the Northland region, Cook County has a higher percentage of people aged 65 and older at 28.5%. And between 2020 and 2030, this population is projected to continue to grow in Cook County. As people age, the likelihood of developing a chronic illness increases, and chronic conditions can affect an individual's ability to drive and often increase the need to access healthcare services. In recent years, it's been longer than recent, it's been a while now since the pandemic, ancillary providers such as ophthalmologists and audiologists have discontinued providing services in Cook County, which results in the need for our residents to travel greater distances to meet their healthcare needs. And when we talk about who we're serving, we are serving parents, grandparents, aunts, uncles, siblings, neighbors, friends, and community, just in general, community members. These are people who want to age in place and remain in their homes for as long as possible. When people are young and more able-bodied, and building their lives in rural Cook County, they are likely not thinking about the day far off into the future, hopefully, where their home in a quiet setting might result in a barrier to them being able to meet their needs. They all deserve the right to access safe and mobility accessible transportation no matter where they choose to live. Getting back into the partnerships and collaboration, I am a member of the Aging Coalition that's been meeting for, I want to say 5 or 6 years now. Also, Care Partners of Cook County. When I first applied for the Live Well at Home grant, the director was Kay Grinlin, and she was extremely supportive in this endeavor, and as is the current director, Julie Wilson. Very supportive and kind of like a cheerleader to say, let's keep this going, let's do this, we really need this. Also, the North Shore Healthcare Foundation has been a supporter of this project. We have a monthly adult care, adult protection team, and that includes North Shore Health, Sawtooth Mountain Clinic, Grand Portage Health Services, Grand Portage Human Services, Grand Portage E&P, and other community providers that have provided input for this project and who I'm updating regularly. Also, my team at Public Health and Human Services, they are the people that are serving our clients. They are really in tune with the needs and are able to give me great ideas and help guide this project in the right direction. And I'm also part of a regional transportation coordinating council. Minnesota has several of these throughout the state. These councils are charged with improving transportation options in their areas. And so that's been a nice council to be a part of. I have gotten a lot of great ideas and am made aware of grants that are available. Funding. So our 2023 Live Well at Home grant, that went towards the purchase of the van that we use for this service. And that was a total of $39,300 was the Live Well at Home grant portion. We had to provide match funds for that. The 2023 and 2024 North Shore Healthcare Foundation grants, I was able to get a total of $12,650. And then MnDOT's Moving Greater Minnesota Forward is a grant that I've applied for and was selected to be a part of their first ever rural mobility cohort. So that took place last fall, 2023. And then I have been selected to receive grant funds for the Phase 2 project, which is a span of 2 years. I didn't apply for a large amount of funds. I'm trying to keep this manageable at this point because, again, I have a regular day job. But the grant funds for that are $4,214.56 for the 2 years. And we're using those funds to provide this service for free at this point to people that are looking for a ride. So what is next for us? You'll see there in the picture, that is our van. That's me and my coworkers, Laura Nelson, who has also been very integral in this project. She is our former in-home support program coordinator, and now she's a adult services social worker, case manager. And then Adam Maxwell is driving the van. This is a picture taken at the Fisherman's Picnic Parade. So we are looking at building our volunteer base. We need drivers. We have some expressed interest, so we are looking to gather those drivers and do a training so that we can get them ready to go. We are also using grant funds to create a website for the project, do some advertising. We really need to get the word out there about this program so that people know it's available. We're also down the road looking at developing scheduling software so that as this gets up and running and there's a more use of it, it's not going to require our staff to schedule the rides. People can schedule them through the software. So that's a quick overview of the program. We're just really, I'm excited that it's at this point. We have a vehicle, it's insured, we have policies and procedures, a handbook for the program, we've got the partners on board, and the excitement about the project. So it's just putting it into implementing it at this point. So that is where we're at.
Thank you. Is it time to start pushing it? Is that you're
Yes.
ready to do it? Awesome.
Well, we need drivers
Sure.
first, so we're
Mhm.
wanting to get the drivers on board. And then, yes, we're gonna be really getting the word out there that we have this service.
Yeah, I can imagine a tagline like, "We go where Arrowhead Transit won't," or something. You know?
Trying to be respectful.
Yeah, oh, absolutely. Yeah, well, there's
Yeah.
limitations. And
Yes.
it's factual. Maybe, yes, it could be more tactful, I suppose. Frank, you have a question?
Yeah, and a couple. Number one, how will people request a ride?
So currently, we will have people call into Public Health and Human Services. They can either call our front desk, which is 218-387-3020, or they can call directly to Ariel Charlier. She's our new in-home support coordinator, and her number is 218-387-3629.
Okay, and that's not public yet? That's not put out?
We did put that in our, we had a article in the paper on Friday in the News Herald, and that number was in there, so,
Okay,
yeah.
I must have missed the article. Okay, so just so I clarify, I live up the trail, Gunflint Lake, 50 miles from here. Somebody up there needs to come into the clinic on Wednesday at 2 o'clock. They can call that number, and if the schedule permitting, they can get an appointment.
Yes, so
Someone at Gunflint Lake wants to go to the Grand Portage Casino.
that is not on our, on our service menu
Okay,
yet.
well, this is what I'm
But that's
trying
what we want to move towards, because we also understand there's a piece of health, is obviously mental health, and social isolation is something that people are experiencing. And so as we have more drivers and get this moving, our first priority is the medical appointments,
Okay.
but we do want to move towards socialization.
But
So,
for now, it's only medical appointments.
correct, yes.
Something you might want to add in at some point is package delivery. In other words, not UPS, but if somebody wants to place an order from the co-op or Johnson's or IGA, it could be picked up and dropped off, hopefully in coordination with some other rides going on.
Yeah, that's a great
If
idea.
you're going up the trail for something, probably too hard to schedule. And the final comment was, rather than developing your own scheduling software, there's a lot of good scheduling software, off-the-shelf stuff that can be adapted much more cost-effectively than trying to develop it yourself.
Yes, we won't be developing, I'm sorry if I misspoke, but we'll be using something that's already developed. We just need to get plugged in, find something within our budget, and get set up.
That's great. I was very, very happy to hear about this.
Is that your hand?
It is
James?
my hand.
James, please go ahead.
Thank you, Mr. Chair. Great presentation, Martina, and really glad that we're doing this. A quick question, in terms of kind of investigating the driving history of volunteer drivers, what kinds of things would cause us to say, no, thanks, we can't use you?
Yeah, that's a good question. We are running what's called a net study, background study on all of our drivers, and that should catch the driving history pieces. We also ensure that the drivers have a valid driver's license and their own insurance, that they possess those things. I don't know that other volunteer programs do a deeper dive into the driving history, but I feel like that net study is really comprehensive in terms of any charges or convictions, I should say.
Would something like speeding tickets preclude somebody from being able to drive for us, or?
I don't think so. I don't know. I don't think so. I'll look into that.
Thanks.
Any other questions, comments, thoughts, brainstorms? So currently free, I caught the currently part, and that's largely for the 2-year grant of total of around $4,000 some dollars.
Yes.
I'd be surprised if that's going to cover it, depending on the use, but step by step here, and we'll
Yes.
get a much better sense. So is the kind of hope, depending on what we demonstrate, that there might be other opportunities for funding after this 2 years, and otherwise we'll also have a better read on what it is actually costing too, right?
Yeah, one of the things that we talked about, the group, so Julie Wilson and I, and Minda Andrus, who is an employee of Care Partners, and Laura, in our planning for this program, we talked about, are we going to have the drivers be reimbursed, or are we going to have this done on a volunteer driver basis? We're starting with this model because we know how it works. It's already existing. There are people that do like to drive and don't necessarily want to be reimbursed for that. But that our model might change if we find that we're not recruiting drivers and we need to provide some incentive to drive. Then we will look into that and might need to tap into some different resources. So it's definitely not set in stone. We're just using this model for now, but in the future, we might even need to charge a little bit for people to use the service.
Yeah. Yeah, I'm happy that it's a developing scenario, and it could be a both and. There could be some people that need to be reimbursed, or some people that don't need to be reimbursed, and then again, there could be a fee structure depending on various factors, and yeah, there's all different ways to go. I'm sorry, Frank, you were gonna.
No, I assume the van is going to be based like here.
Yes.
So a volunteer driver would have to come here. I'm just thinking of it like, again, my area's up, have to drive an hour, pick up the van, go pick up somebody driving.
Yes.
And then get the van back. Okay.
The nice thing with Care Partners is people are using their own vehicles, so if there is a volunteer up the trail, they are local and they can do those rides. But yes, if there's a mobility need, someone in a wheelchair that needs that vehicle, needs our vehicle, they would have to drive down and pick up the vehicle and drive.
Scheduling with Care Partners, same phone number?
Care Partners is a different number. I can look that up real quick.
That's okay, I saw one of their flyers
Okay.
in the grocery store the other day. Okay, thank you.
Yes.
Mr. Storley.
Thank you. Just age verification, is it 65 and older?
Currently it is. Again, that's
Okay.
where we're at right now, but that has a potential to change in the future.
And how many people could the van accommodate in a run?
So it is set up to take 2 wheelchairs in the back at one time, and then there's a seat there's a passenger seat in the front. But also in the back, we have seating bench chairs that fold down.
The stowaway, is that the?
Yeah, they're typically up, but they fold down and they are seats. So if we had one wheelchair in the back, we could fold those 2 seats down and transport 4 people, passenger, and then the 2 seats, and then the wheelchair.
Oh, okay, good, thanks.
I'm sorry.
Please.
If there are two people with wheelchairs and they have 2 caregivers, would that, I mean, if you have more than one passenger, could you do that, or?
We probably could not, because those seats in the back can't be folded down if there's a wheelchair in that front area. You can see in the 3rd picture down that that seat is folded down. That's one place where we can tie in a wheelchair, and then there's a space behind it. So we wouldn't be able to transport 2 caregivers with 2 wheelchairs.
Presumably a front seat and possibly the driver would be available to
Right.
push a wheelchair?
Yep.
All right, well, thank you very much. Any last questions? All right. Well, thanks for the update, and keep us posted, and very exciting program.
Thank you.
that moves us down to our director's report, and first thing is the staff updates. Allison.
Before I jump into the staff update, have to start with a recognition of Martina for all of your tireless efforts, your leadership on this project. It's been a really big initiative for you to focus on in the midst of all of the other priorities that you have as a part of your work as a supervisor and providing case management support during staff transitions. So just want to echo the gratitude for you and your work to create this new resource for our community. It's really huge. Thank you.
Thank you.
All right. Good morning, Commissioners. We have an updated organizational chart included in the agenda packet, as always. We'll summarize a few changes since our last meeting in August. As Martina mentioned in her presentation, Arielle Charlier has transitioned from her role as an eligibility specialist with our economic assistance and healthcare team into that in-home support coordinator and adult services case manager role within the adult and home and community-based services team. That, of course, created a vacancy within our economic assistance team for which we are currently recruiting. We have interviews scheduled this week to backfill that eligibility specialist position. We are excited to welcome Betsy Blaisdell next Monday, the 23rd, as our office support case aide position. This is the second in line in terms of that front office window and any calls that are coming into our office. Betsy will be that primary backup to Leanne at the front desk for reception and also do some specialized tasks in support of our economic assistance team. So some data entry, actually determining eligibility for some programs that are appropriate within the scope of her job description. So really excited for Betsy to come on board and have a fully staffed front office team once again. On the consent agenda this morning, you accepted the hire of David Ritmo as our coordinated crisis response worker. This is huge. We've had this position vacant since May of 2023. John Speaker, our behavioral health supervisor, Andrea Orest, who's a member of our public health team, have done an immense amount of work over the last year and a half to continue the momentum on that pilot program while the position was vacant, but we're very excited to have someone coming on board in that position. David visited Cook County in August and met with staff and partners. He is relocating from outside of the area, so is looking for housing. And we're working on some creative problem solving to be able to get David started on some of his onboarding and training while he's looking at securing housing within the community, as there's quite a bit of mandated systems training that he would need to do before really getting started in that role, providing direct service. We are targeting a late September, early October start date for him, again, contingent on finding housing. We reposted the children's mental health case manager position. This is backfilling the vacancy created by Marissa Chapman's transition to the developmental disability and community access for disability inclusion waiver case management on the adult and home and community-based services team. We have had to repost that several times, and we've also had 2 offers declined for that position. So this is informing my recommendation under items for board action to also explore some temporary employment arrangements, as we're seeing really significant caseload and complexity with the children that are being served through children's mental health case management. So I'll go into greater detail on that request once we get to items for board action. In our posting, I asked that our HR team include language that we're open to temporary and part-time placements as well, so that we can really widen the net in terms of folks locally or even outside of the community that might be interested in either a temporary, part-time, or full-time permanent position. We interviewed last week for the Children and Family Services Supervisor position and are very excited to have extended an offer and had that offer accepted. Anticipate bringing a hire recommendation before the regular board at the September 24th meeting once we're able to do some internal communication around that hire. We are also interviewing for the Children and Family Services Case Manager. That is that new full-time equivalent position that this board authorized at our August meeting. We have several candidates to consider for that position as well. That leaves us with 3 unfilled vacancies at present, not including the anticipated vacancy for our Children and Family Services Supervisor. We are also proposing a part-time, fully grant-funded position for 2025 that is included in the Department of Human Services Mobile Crisis Response Grant application that we submitted last month. This would be a mental health worker who would be embedded within the Grand Portage Human Services team to provide relief to their team, who are doing quite a bit of crisis response and dedicated support to the Grand Portage community. This is someone who would work alongside our full-time mobile crisis response provider who serves all of Cook County, including Grand Portage, but is a part of our strategy to ensure staffing coverage throughout our large geographic area. We will not be recruiting for that position until we have grant notification from the state that those funds are secured. Any questions about my staff updates before I move on to my department report?
Doesn't look like it.
On the consent agenda were the financial report for through August year to date. Thank you to Plumman for including a helpful summary in terms of where we're at and where we expect to be at this point. Plumman identified a few areas that are over budget, including Children and Family Services, where we are at 125% of our budget. The items under this category that are putting us over budget are FARS, PSOP, and adolescent life skills. These are all preventative family services funding streams that we're able to target families in need and provide support to prevent out-of-home placement. Everything else is related to child protection at 146%. For out-of-home placement costs, we are at 135% year-to-date. We are seeing a lesser amount expended in August when compared to the previous 6-month average, and even less than in the month of July, so expect this to continue to trend downward or level out through the end of the month. In terms of revenue, we received a $16,000 North Star foster care payment in July, labeled for Q4 2023, which brought our revenue up for out-of-home placements to 117% of the budget for this year. Even though that was for last year, because it was received at this point, we've done all of our quarterly and year-end reporting. That will be 2024 revenue. The financial report also includes the first tax distribution of the year, which was received in May, and all other expenditures are in line. We are continuing to work on the development and refining of our 2025 department budget as we receive updated expense and revenue information. Things like position changes, internal promotions, filling vacancies all impact our personnel budget as we're using actual step and wage information in our budget for 2025. Job description review is also having an impact on our projections for 2025, as well as the new information on insurance premiums. The CCA contract negotiations all impact our department budget as well as our revenue as we're reporting expenses to the state and receiving reimbursement from the state and federal government for those staff expense. The biggest potential change in our expense and revenue is the Department of Human Services Mobile Crisis Grant application, as that will both increase the expenses for our department and increase the revenues alongside that. Any new expense included in that Mobile Crisis Response Grant will be fully funded through the grant. Other major initiatives for our department is implementation of CaseWorks, the electronic document management system for economic assistance, healthcare, and social services programs. Training is underway this week for all of our economic assistance and healthcare staff, with go live next week in the new program. We're having to do quite a bit of upfront work for our social services team, as we have not had an electronic document management system in place. To date, we've been using paper files and a variety of electronic file systems that are not true workflow systems. So we're having to do a lot of work to define our business processes, who has access to what documents, ensuring that all of the unit department naming within social services information system, the state mandated documentation and reporting system, is in alignment with Caseworks. So grateful to be going through this as a region so that we can lean on some of our other peer counties to see how they're planning for this major shift. Go live for social services is the week of October 21st, so coming up. The Mobile Crisis Program development is another major initiative. Policy development is one of the components that we need to have in place before becoming certified. Thankfully, we have a number of other DHS licensed programs that we're providing, the in-home support program, the wilderness outpatient substance use treatment program. So we have been able to modify some of those program policies in place for other DHS licensed program in preparation for providing the mobile crisis services. We are also working with a number of different vendors to determine what electronic medical record system is going to best suit the program. That's also something that we need to have in place to be in compliance with the state to provide mobile crisis services. Again, I'll say more about that under items for board action. Have to share some good news along all of the other staff transitions and major projects that are underway. We received just this morning a certificate from the Department of Human Services that in Q2 of this year, Cook County met SNAP, that's the Supplemental Nutrition Assistance Program, expedited, so that is for individuals who qualify for receiving their benefits right away based on having either limited income or a combination of limited income and high housing and utility expenses. Then our staff met processing standards both for those emergency expedited applications and other 30-day processing standards. So any other application that does not meet those expedited criteria is required to be processed with benefits issued within 30 days. Our staff met or exceeded that 95% threshold set by the state. So that means over 95% of Cook County residents, when they apply for SNAP, are receiving those benefits within the state mandated timeframes. So kudos to our economic assistance and front office team. Also in the last month, our public health team, Andrea Orist really leading the charge here, has put in place harm reduction cabinets in each of the 4 restrooms in the Cook County Courthouse. You heard a presentation at our meeting last month from Andrea, as well as Brenda Port, about our harm reduction initiatives, both as a department and in partnership with other organizations in the community. This is an effort to increase access to these materials. As you might remember, they started out at our front desk, then we had a cabinet in the lobby, now they're in the bathroom, and this is a part of continual improvement efforts to increase access to these supplies throughout the community. We have a number of staff supporting events in Grand Portage this weekend, including a bike rodeo and some suicide awareness events. So the team will be staffing a resource table at that event as well. And that's what I have to summarize the work of our department in the last month. Happy to take any questions before I move into items for board action.
1 or 2 things, eh?
Just a bit.
Yeah, good work. It's incredible.
Busy team, busy time of year.
Yeah. Questions? Let's move on to items for board action then.
All right. So first up, before you today is a request, item 5A, to approve a contract with Temp Social Work, which is the name of the organization, for the placement of a temporary social worker. I met with individual, the director of the Temp Social Work Agency earlier this summer to learn more about the services they provide. This is a Minnesota-based program that can assist with placement across a range of settings, including hospitals, counties, mental health providers. Their mission is to fill short-term gaps. So typically if someone is on a family leave or there's a transition in between positions, their goal is to support providers, whether they be county, tribal agencies, hospitals, or otherwise, with maintaining service delivery during those staff transitions. As I reported under the staff report, we have had a vacancy on the children's mental health team since early July. We have done multiple rounds of interviews. We have extended job offers. 2 candidates have declined offers. We have reposted the position and are continuing to look for a permanent full-time placement, but again, are hoping to cast as wide a net as possible. The team is really in need of immediate staffing support to meet the needs of children currently receiving case management services, to be able to respond to any new referrals we might receive, and provide relief for staff who are currently far exceeding state recommended caseloads for children's mental health case management, and staff who are working outside the scope of their current job responsibilities. Currently, we have adult mental health case management staff, we have our supervisor, all working to support our 1 children's mental health case manager in balancing their caseload. The purpose of this request is to temporarily fill a vacancy on the behavioral health team while continuing to recruit for a permanent hire and to enter into a contract agreement for a case manager with experience in children's mental health and child protection who can provide support for 6 to 12 months to both teams. One of the benefits of this organization is that they have a temp to hire program where we could work with someone on a temporary placement and they could go through the merit system and county processes for a formal recruitment and hiring process and be permanently placed into a position. Some of the rationale behind this request: the Department of Human Services recommends that the average caseload for a full-time equivalent children's mental health targeted case management case manager be 15 clients. As of July 2024, there are 29 open children's mental health work groups in Cook County. As we added a second children's mental health case manager within the team, we were able to provide support to more families and children needing children's mental health support. As that position turned over, we're having to manage that caseload of 29 across a number of different staff, not providing the level of service that we would like to these families. As I said earlier, the current caseload is distributed across 1 children's mental health case manager, the supervisor, and adult case management staff. We have extended multiple offers and are looking for that immediate support to the children served and to our team. I shared the contract with County Attorney Hicken for her review to ensure that she doesn't have any concerns with that, and pending any feedback or comments from Molly, my intent is to start working with this agency immediately on placement of a temporary social worker, knowing that it could take time for any temporary worker to be able to find short-term housing in the community. We're also reaching out to individuals in the community who we know have case management or county work or SSIS experience to see if they'd be interested in a temporary placement as well. So again, casting as wide a net as possible. Hopeful that those offers that we had made would be accepted by this point, but we're having to get creative.
Do you have any feedback on the offers and why they were declined?
Of the 2 individuals that we interviewed, both cited that they just weren't ready for the transition of moving to a new community. They were people from outside of Cook County who interviewed. Although they were interested in the position, the timing wasn't right for personal reasons, or they just weren't prepared to relocate. So we're hopeful to stay engaged with these candidates.
Mm-hmm.
Perhaps the timing will be right down the road, and they could consider other opportunities with the department.
Thank you.
Mm-hmm.
Yeah, this is not ideal by any means, but I really appreciate you looking for some solutions, even if they're temporary. Of course, continuity of care is something that's always on our minds, but some temp is better than no help, especially with the caseloads that we're facing. So, thank you for looking for solutions and casting that broader net.
Absolutely. Thank you, Commissioner. And I should add that these are individuals who have experience doing case management in Cook County, so they would be able to jump pretty quickly into a role with our agency.
Commissioner White?
Is there a time limit on how long a temp will stay on a particular, in a particular position? I know that you said what the contract length was, but can we monopolize a person for 6 months, or is it like 3 weeks, or just until we get it filled?
So the organization that we're proposing contracting with focuses on short-term placement, although they do have that temp to hire program. Our intent is to look for someone who is willing to provide 6 to 12 months of support. Our county employee handbook defines a temporary employee as a 6-month placement, but we do have the opportunity to renew that placement.
Thanks.
Any other questions? Frank, please.
Just roughly, what's the difference in cost between a temp contract versus an FTE?
That's a great question.
25%.
Thank you.
25?
From the hip.
If I remember
Which
correctly,
way?
the rate is $55 to
Against us.
$61 an hour in the contract. For a social worker. We have wage frameworks that we've used in the past for bringing on temporary case managers. It's been quite some time since we've had to bring on a temporary case manager.
Right.
So that wage has varied based on that individual's experience.
You're right, but for a new FTE, not temporary, but a new hire.
A new hire. So
Yeah.
including
Salary and
fringe and
fringe, yeah.
benefits. That's a good question. I don't know that I can answer that off the top of my head.
Okay.
In terms of what that hourly breakdown is,
But
including
again,
fringe.
Yeah, there's not any available, so you're doing the best you can with
Right.
with what is available. And I think, I echo that. It's great that you're able to do that at all.
Yeah, this is definitely more expensive, to be clear, by, I'm guessing 25 to 30%, but again, that's from the hip, so
Yeah.
what do I know?
Would you say there's, okay, when you reach your maximum caseload, do you turn away clients, or do you just accept everybody who needs it? What happens?
We haven't ever had to turn away someone who has requested services or referral is made by a partner agency. We might not be able to be as timely in responding to that referral or provide the level of service or frequency of contact that we would like to based on our practice standards and history. So we haven't gotten to that point. I would like to avoid that at all costs.
Yeah. Thank you.
But yes, and the entry wage for a social worker, this is just hourly wage, not fringe, is $30.71. So that's step one on our 2024 wage scale.
Thank you.
So up to twice as much for a temporary placement. But again, we're looking at experienced social workers who would be able to go right into the work and not go through a lengthy onboarding and training process that would be expected of someone coming in at a step one.
All right. Yes, Commissioner Johnson.
I was waiting to see if other people could ask some of these, but I have a question about, will this person be based here in Cook County, or will they be traveling every day for work?
Ideally, this person would be based in Cook County so that they could be integrated within the team and be a part of visiting clients who are located in Cook County. We do have people that we serve who are placed outside of the county and in foster care or residential settings, so there may be opportunity to work with someone who is located out of Duluth, Two Harbors, Silver Bay. We have permanent staff who are recruiting or who are
Residing.
commuting from that distance already. Ideally, we would have someone here in Cook County, but would be open to folks in the region who would either be traveling or able to see people who are outside of the county.
Okay, so if that person is residing, well, either way, will they have an office space here that they're required to come here to the courthouse to do work and meet with people?
Ideally, yes, they would use a vacant office that we have within the department right now to be able to meet with people in office and meet with people in the community.
Okay, ideally, but if they don't, they will just be contracted to visit people that we are serving outside of the community? I'm trying to understand.
That would be one option that we could consider. There are other documentation or other contact and compliance tasks that we could delegate to a case manager to free up our staff who are located in Cook County to be able to spend more time with clients or respond to
Okay.
new referrals.
So more like the paperwork end of it.
Potentially, yes. We haven't gotten into that level of detail yet with the contractor to determine how we would operationalize this agreement, but I can imagine there are a few different scenarios in which we could get support from a person who isn't physically located in Cook County.
Okay. Is this temp position considered 40 hours a week or less, or?
We would be looking for a full-time placement, but open to part-time as well, if that were a deal breaker in terms of getting someone placed to support our department.
And so in the contract, it said we're committed to 350 hours.
Okay.
Are we delaying posting for the new position for a couple months, or what do we do if we have an applicant? We are kind of committed for the next 6 months. I thought it was more than that, but okay. I thought we wrote down something here about 6 to 12 months. So how's that work?
We are actively recruiting for the full-time permanent position as well. So if we have a temporary placement for 6 months, that would provide continuity, overlap, support while our new worker is going through training and onboarding to be able to perform at the level of a fully trained case manager.
Okay.
Just time frame. If you had somebody today who said, yes, I'll take the job, I'm guessing it would probably take 2 to 3 months to actually get them to visiting their first client?
At least, yes. Yeah. So typically, a new social worker is going through a period of 6 months of training before they are serving on intake, which is a core function of our case management team. Oftentimes, we have workers who are shadowing, starting to see clients sooner in that 3 to 6 month range. We don't have the luxury. I think it's fair to qualify it of going through 6 months to a year of training for our staff, as oftentimes that vacancy has been open for 3, 6 months, even a year in the case of our most recent Children and Family Services case management hire.
So the 6-month contract is not really you're not going to have too many people.
We're not going to have too many people. We're not going to have not enough work if there's an overlap of a temporary case manager and a permanent case manager.
Thank you.
And there is a termination clause too, if
Okay.
that does
Yes.
happen, but, yeah.
Madam Chair, I also have a question. So,
Well, attorney, you can go right ahead.
I'm sorry, I said
It's all a good fun, please.
Chair, non-genderized. So I heard Commissioner Johnson refer to a 6-month contract, and I've heard others too. The contract that you sent me to review, it's 4 pages long, and maybe there's something else, an addendum that I'm not seeing, but where in this contract does it say it's a 6-month term?
That is not specified in the contract template provided by the vendor. That's what we as a department are targeting in terms of a placement goal for a temporary employee would be a period of 6 to 12 months.
So are you asking the company, the contractor, to provide somebody for 6 months?
Yes.
Okay. So we will need to make some changes to the contract. The other thing I'm seeing, so the only thing I see related to 6 months or 12 months, and just to make this clear in case it wasn't understood, that the, if we were to hire this person, let's say we extend an offer because it's going really well, we are agreeing that we will pay them some kind of a referral fee, unless they've been employed at least 6 weeks. So, I'm sorry, 8 weeks. 8 weeks is 350 hours, and that's the reference in the contract to the minimum 350 hours. And there's a termination clause, correct, that only requires 30 days prior notification. It doesn't require any kind of cause to terminate. It just requires that the person, if we give less than 2 weeks termination notice, the contractor has the right to continue billing for the balance of 2 weeks. And then it says, if we terminate that contract and then we hire the person within 60 days of terminating the contract with TSW, then we have to pay them a referral fee equal to 5% of the employee's first year salary with the client, or $3,000, whichever is greater. So if it does turn into a referral source for a permanent employee, just so everyone's aware that there would be an added cost to that. We weigh the value of, yay, another permanent employee versus that cost, but.
Thank you.
Yep.
Any other questions here? Commissioner Johnson?
So you've got the contract. When would be the start date of this contract? Will it be like today, after this is approved, and then we have somebody?
I don't anticipate that they would be able to meet a same-day turnaround time for signing the contract. So once I have board authorization to move forward with contracting, I'll reach back out to the agency and start talking about some of the logistics of the placement, what we're looking for, what we have targeted for a time frame, confirming some of the contract language that Attorney Hicken mentioned around the Temp to Hire program. Is that something that we would want to consider, knowing that we would have to pay a fee? So I would begin conversations about, do you have someone identified who could fill this gap, who is experienced in children's mental health, who could also provide support to children and family services, and what's the time frame for getting someone started? I did not anticipate that this would be immediate. I had imagined it would take at least 30 days, 60 days to identify someone and then to have someone placed and beginning onboarding with our department. Again, alongside that recruitment for the permanent positions.
You probably have a lot better perspective than me, but I'm really hopeful it's faster than 30 days. A week, 2 weeks, oh yeah, we've got somebody. But then it's the training,
If Allison can't find a person to take the job, I doubt there's a warehouse full of them somewhere just waiting for a position.
Good point. I am imagining that, but yes, good point. And then in regards to amending the contract for the 6 months, which is the target, that, do we know if temp social work is open to that? I mean, can they fulfill that even?
That's what I cited in my
Yeah.
initial discovery call with the
Yeah.
contractor. So again, once I have a chance to reconnect with her pending board approval, we'll talk through that time frame. Is that feasible for a placement? Is it necessary to spell that out in the contract? How have other organizations approached this in the past?
Okay. Other questions, Commissioner Johnson, anything? So Attorney Hicken, it's your recommendation that we include that language now, or Allison, are you wanting to have the discussion first, or what's our tact there?
So I'm going to partially defer to Allison and see what she says, but what I'm gathering is that she's looking for board approval to the general concept and then taking that back to negotiate some of the smaller, well, a big detail is that term of the contract. How long are you willing to provide us with this temporary employee? There are other things not addressed in the contract, like does the person have a desk here and a space and county equipment? Is the person going to, does the contractor agree that they follow certain county policies, like our drug and alcohol-free workplace policy and other policies related to internet access and those kind of things. But anyway, I deferring to Allison on timing, I'm wondering if we'll be bringing a final contract back to the board, because there are a few things missing from this one that, in order to protect the county, we should be including in a more fleshed out agreement. Is that accurate? Sorry. Go ahead.
Sorry, Mr. Chair. Is that something we could do at a regular business meeting? Or, I mean, if there's agreement among the PHHS board that it wants to enable Director McIntyre to do this, could that approval occur at a board meeting, or would we have to wait another month? That's my question.
Oh, and can we go through some of those other items that should be in the contract?
Mr. Chair, this board could delegate authority to Allison McIntyre or to James Yorkie to sign the contract once it's fully approved by the county attorney. You could include in your motion the types of terms you want us to include in the contract or to fight for or negotiate for. And then it would not have to come back in front of this board except to say, the contract is signed, here's what we've wound up with.
Mr. Johnson?
And I appreciate that. I also think maybe the three of you should get together and talk about it and figure it out, put it together, bring it to our next board meeting, and because it seems like there's consensus here, this is the way we need to go. It's the details that need to be worked out that haven't been done yet. So work out the details. It's something that's, to me, not a big deal as long as you all three are looking at the way what needs to get put into a contract, make sure that the county's covered liability-wise with our policies, and you're getting what you want with the terms you want. So my suggestion is, let's send this back and then put it on our next agenda. It should be real simple with the actual contract that has been figured out by our county attorney.
Mm-hmm. Yeah, I don't want to lose any more time just because of the situation regarding caseload and staff. And I agree that I think we're all on the same page there. And so I think we can just delegate, as Attorney Hicken was suggesting, and then, have it brought back if there's any substantive changes or differences from what we were anticipating or expecting or aiming for. Commissioner White?
So you're recommending that we approve something before we really know the details? Yes, we are all in, seems like we're in agreement with this, but you are recommending that we approve something without knowing the details?
What I'm suggesting is that we delegate authority to Director McIntyre to sign the contract pending, again, legal review and all the bureaucratic checkboxes, and then coming back if there's any changes from what we were just talking about. But that's why I think it's important to talk things through to make sure that we all have that same vision, and it's on public record, and then we can go for it without the churn, unnecessary churn, and then get a report back if, in fact, that's not how it went, or ideally, yes, all systems go here, but. Are there details that you would like to know more about?
No, what happens if we suggest something and they say, well, I don't know what it would be, but if they say, well, no, well, this is going to be an additional cost, or we really can't do this, or there's going to be limitations, then we just allow our attorney and the administrator and Allison to work out the details, which, because I'm assuming they would know how best to do that.
Better than me.
I will not respond. Okay.
Mr. Chair and Commissioner White, there are several options that the board has. I mean, you get to give a broad delegation of authority, or you get to give a narrow delegation of authority. You can say, so long as the price is the same or doesn't adjust upward by 10%, and you've checked these boxes for county liability, go for it and sign it. Come back and let us know if that doesn't work out. Or, do you know what I'm saying?
Yes.
So the details, it might be, it might be helpful to hear what details you're concerned about going either way, so that those are things we can focus on in the negotiation. But, you know, Ms. McIntyre, Mr. Yorkie, they are subject to the authority of the board. They're going to act consistently with the board's decision today. And I'm not going to allow, or I'm not going to advise either to sign a contract that doesn't, isn't consistent with protecting the county from unreasonable liability.
I want to agree. I don't think we want to delay. I mean, you know, we don't know who would apply, what their qualifications would be, any of that. I mean, we know there are some because they've been approved by this organization, but there could be some variation in all kinds of things with a position. Maybe they already live here, who knows, you know, but I think, so I think just approving Allison to get on with it, I think it would be really harmful to wait another month to decide that, because it's already, we know it's going to take a while, even as it gets started.
Yeah, Commissioner
That's my
Singh.
opinion.
Mr. Chair, I'd like to make a motion to delegate authority to Director McIntyre, once approved by the county attorney and our county administrator, to move forward with this.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
I so support.
Thank you, Frank. We have a motion and support. Further discussion? As far as I'm concerned, that the 6 months in the contract wasn't important to me. It was just kind of whatever we can get. And I know that's the aim, so that's our ideal, but that wasn't for me a deal breaker by any means. Attorney Hicken, are you feeling like that's pretty important to have in there, or is it kind of based on?
The term, 6 or
Correct.
12 months. I mean, that seems like a business decision, not one necessarily, I mean, it does increase the liability of the county if they attach some penalty to exiting the contract prior to 6 months. But that's a give and take. Sounds like there are business reasons that Ms. McIntyre has outlined for the board to ask for a 6 month, at least a 6 month term.
Commissioner White?
And if we get a person, a temp, and then we are able to fill this position, can we then get a temp for another position? I mean, we have positions all the time. Can we just, maybe not the same person wouldn't be sliding over, but that we would then have the ability through this agency to continue to use their temp services for whatever position?
Potentially, it's more expensive, and and, you know, it doesn't necessarily bring that continuity that we're looking for, but it could be some solutions there, yeah.
Well, right.
Better than nothing, right? Yeah.
Okay.
All right, we have a motion and support for the discussion. Hearing or seeing no more, all those in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. On to item 5B.
Next on the agenda is a request to approve an increase in hours for a public health educator, SHIP coordinator / regional lactation specialist from 35 to 40 hours per week. In May of 2023, this board approved an increase in hours for the public health educator, SHIP coordinator position from 24 to 35 hours to fill a regional gap in services, providing technical assistance and support to regional breastfeeding systems, as well as the 7-county Healthy Northland SHIP group. The Regional Community Health Board, or CHB, approved an additional $60,000 in funding from the Centers for Disease Control, or CDC, Infrastructure Fund, effective November 1, 2024. The CDC infrastructure funds will replace the additional SHIP grant funds that were previously allocated to the 7-county region, allocated to this position in support of the 7-county region. With this change, the regional lactation specialist support will be limited to the 4-county Community Health Board. The allocation of funds was approved by Community Health Board staff and Northeast Public Health leaders, with formal approval anticipated at the Community Health Board at their October 21 meeting. The increase in hours for this position, bringing it from 35 to 40, is fully funded by that $60,000 CDC Infrastructure Fund grant, and we have that funding secured through January 30th, 2027.
Thank you. Questions about this one?
I'll just identify for the public that we have a number of staff from our public health team to be able to support any questions that you might have about this change in hours and the new funding.
Thank you. Any questions? Any motions?
Mr. Chair, I'll make a motion to approve the increase in hours for the public health educator.
Thank you, Commissioner Starr. We have a motion, support from Martina.
Support.
Thank you. Further discussion? What happens after 2027?
As we always do, our public health team will be aggressive in seeking out additional grant funds to either maintain the staffing levels that we have currently or pivot and seek out other new funding sources to meet other needs in the community.
Mm-hmm. Yeah, I've been getting excellent feedback in the position from the CHB and the regional staff, and I witnessed it as well here locally. So I really value the work, and think it's a really wise way to invest in our community, the health and getting ahead of problems down the road. I'm just trying to keep people healthy from the get-go. So a very strong campaign thus far. Any other questions, discussion? Hearing or seeing none, all in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. Moving on to 5C.
Right, next up for your consideration is a request to allocate $69,912.50 of the county's opioid settlement funds towards ongoing harm reduction initiatives, prevention, and recovery supports. To date, the county has received $125,300.68 in opioid settlement funds. We anticipate continuing to receive funds from the various settlements, the various opioid manufacturers over the course of the next 18 years. The last request for allocation of funds was approved, I believe, in 2023. So we're looking at allocating additional just shy of $70,000 in funds towards overdose prevention, training, and supplies that aren't covered under the federal HRSA grant for the Rural Communities Opioid Response Program. Our department, Grand Portage Health Services, Grand Portage Human Services, Sawtooth Mountain Clinic, University of Minnesota are the primary grantees under that RCORE grant, and the consortium partnership includes several other local and regional service providers, each of our local schools and Cook County Higher Education. That RCORE Prevention and Recovery Group has endorsed this plan with additional consultation with the Cook County Attorney and Cook County Sheriff. Enclosed in your meeting materials was a detailed budget and budget narrative for how we will target the use of those settlement funds. I'll add as well that we're having some conversations internally about how to develop a more robust process around allocation of our opioid settlement funds, and are balancing the fact that we have limited funds. We don't have the millions of dollars that are being allocated for other counties and municipalities in our state. But we also want to have a more transparent and equitable process, more community engagement, more involvement with other partner agencies. So that's something that we're working through right now, alongside the request before you today to provide immediate funding support to some of these initiatives. And again, we have staff in the room today who are much more deeply involved in the development of this budget and the consultation process, so happy to address any questions from the board.
Only question I have is just about the remainder of the funds. Did you speak to that at all?
So the total amount we received to date is just over $125,000. We're recommending to allocate just shy of $70,000 today, and I believe our initial request was $18,000.
And to be determined for the remainder.
To be determined
Okay.
in terms of that ongoing allocation.
Yep,
It's
great.
a little unpredictable.
Yep, that's all I was wondering. Thank you. Questions about this item? Commissioner Sullivan?
Mr. Chair, I'd like to make a motion to approve the allocation of $69,912.50 of our Cook County opioid settlement funds.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
Support.
Thank you, Frank. We have a motion and support. Any further discussion? Again, hearing really positive feedback in the community and regionally for your work. Thank you very much, and I think this is money well spent and very important, so thank you. Anyone else? Otherwise, all in favor? Aye. Opposed? Motion passes unanimously. Thank you.
Thank you.
Moving on to item 5D.
The last item before you today is, again, a request for delegated authority to enter into contract negotiations with an electronic health record vendor for behavioral health services. So the recommendation is that this board authorize me to negotiate in good faith with a vendor to procure an electronic medical records system that is compliant with the Minnesota Department of Human Services Mobile Crisis Response Standards at a cost not to exceed $70,500 for initial implementation and $4,000 ongoing monthly charge. The implementation and ongoing monthly expense will be funded through the Department of Human Services Crisis Response Grant. To become a certified mobile crisis response provider, Cook County will need to invest in an electronic medical record system that is compliant with state standards. To date, a number of staff in our department and our contracted service provider from the Wilderness Outpatient Treatment Program have participated in a series of meetings and demos with 2 different electronic medical record vendors. Our strategy in seeking out vendors has been to work with vendors that are already in use by other regional mobile crisis response providers. So what are providers in our area already using, and how can we capitalize on what is already in place within the region and even already in place within the county in terms of finding a record system that might not integrate fully across provider systems, but we would at least have that opportunity to learn from workflows, business processes, documentation standards that other providers in the area have in place. To date, we have received a pricing proposal from one of the two vendors that we've been working with and are waiting for cost estimates from the second vendor. The budget for the Cook County Mobile Crisis Response application includes $110,994 for contract year 1, 2025, which includes implementation and monthly expense for the year, and $40,494 for contract year 2, representing those ongoing monthly expenses. We are also exploring transitioning our current electronic medical record for the Wilderness Outpatient Treatment Program to this new platform. So we have one platform for all of behavioral health services and not a whole new system that our scheduling and administrative staff and billing and reporting staff are having to use. Both systems that we are working with to develop proposals integrate with the mandated state reporting systems that we're required to use, both on the mobile crisis end, that being the mental health information system, and on the substance use disorder evaluation and treatment end, which is DANES, or the Drug and Alcohol Abuse Normative Evaluation System. The purpose, again, is to implement electronic medical record for behavioral health services, including mobile crisis response and substance use disorder treatment and evaluation services. One of the vendors that we've been working with who developed the proposal that informed our budget request in the mobile crisis response application provided a cost analysis, return on investment analysis based on what we were reporting in terms of the duplicate data entry, the manual claims generation, client contact within our current system for Wilderness Outpatient. Again, we don't have an electronic medical record system in place for mobile crisis response, as that program has been in development. We're documenting that in SSIS, which is our social services document management system. It's not a clinical record for behavioral health services, which we need for this program. That vendor estimated a $324 monthly savings based on the current duplicate entry and client contact to follow up on billing, on appointments, that we would actually see a cost savings by investing in this program. Financial implications: the initial implementation and ongoing expense are included in that 2-year mobile crisis grant application budget. I have a formal proposal and a contract. I'm not prepared to present that to the board yet, as we're still working with 2 different vendors, and I am seeking a proposal and contract agreement for the second vendor. So the request before you today is to authorize me to enter into contract negotiations with one of these 2 vendors to be able to procure and implement an electronic medical record system before year end. A few other comments on the request before you today. Again, waiting on another proposal to be able to fully compare the 2 systems that we're exploring. And then I'm also working with the Department of Human Services on getting clarity around the timeline for our grant notification, as I know that is going to be a major factor in deciding which organization to move forward with, as we want to have some indication that we've secured funding to cover the expense of that investment. Also seeking clarity on the expectations for contracting with the state as it relates to implementing a fully functioning electronic medical record system, as this is a major initiative. It can take 4 to 6 months to have something in place. So we've been working through this internally from a fiscal, administrative support, scheduling, and clinical standpoint. I have updated our MIS team that we're moving forward with this and that I intend to bring them in to the negotiation and discussion as we have a better idea of what vendor we'll be moving forward with. I imagine that, as with any other system that we are working with as a department within our service level agreement with MIS, it will specify that primarily our department staff are working with the vendor, and there's minimal impact on the MIS team in terms of the ongoing maintenance of and technical support for that system. Happy to address any questions that the board has about this request.
Might this help the behavioral health team at large, or do you think it's primarily for the mobile crisis response?
So what I envision is that we will focus on the mobile crisis response program to start, that will be our goal, to have something implemented on or at least within a time frame that's reasonable to the state for having that in place for mobile crisis for January 1, which is the start of our contract year. As a second phase, I would bring the substance use disorder treatment program into this system. In terms of scoping this out for 5-10 years down the road, the systems that we're looking with, I think, are programs that we could grow with. That if we develop ARMS service, for example, adult mental health rehabilitative services, that this would be a clinical platform that we could use to document those services as well. If we begin providing diagnostic assessments within our department to be able to fill in some of the gaps that our local and regional mental health service providers aren't able to meet, this is a system that we could use as a clinical record for those services. Again, none of this is in the immediate future. Our focus in the short term is the mobile crisis response program, but again, looking at a system that we could grow with into the future.
Thank you.
Both of the systems that we're looking at are compliant with record segregation for chemical health records. So we're able to keep a container around any clinical records that are specific to the substance use disorder treatment program, and those would not be enmeshed with the other mobile crisis services. So that's something that's been important to us as we look at different vendors.
Okay.
One of the vendors that we're looking with has mobile services, so that we would be able to have staff document in the field as they're providing mobile crisis response services in more rural, remote areas of the county. Haven't had a chance to determine if that's a feature that the second vendor that we're looking at offers. So we're a little earlier on in that process. So again, my intent with board approval would be to move forward with contracting and presenting a final contract once I have some certainty around that DHS grant allocation.
Questions for Allison here? Any motions? Commissioner Zeller.
Mr. Chair, first of all, I want to thank you for engaging with MIS to make sure that we're going in a good direction. I would like to make a motion to delegate authority to our PHHS director to contract with an electronic health record vendor for behavioral health services.
Is there support?
Support.
Motion and support for their discussion. Any clarifications that are needed? I just saw different language, but it's probably all fine.
That was my question.
Yeah. It's the mobile crisis response, right?
Well, enter into contract negotiations or contract with the vendor. I was confused by your wording of your
Thank you. All right.
motion, so I just want to clarify.
So
You're going to-
I will clarify that it is to procure an electronic medical record system that's compliant with the Minnesota Department of Human Services mobile crisis response standards at a cost of up to $70,500 for implementation of expense and $4,000 of monthly charges.
And I have clarification for our attorney. Does that contract still come before this board then, final approval with that motion?
What did the original motion, I'm sorry, I didn't follow every word of it.
I asked to delegate authority to our PHHS director to negotiate in good faith with a vendor to procure an electronic medical records.
That, then the contract would have to come back in front of the board for
Right.
final approval, yes.
Thank you, just wanted that clarification.
And Rana, your support is going with the
Yes.
clarification? Okay, thank you.
Thank you.
Any further discussion? Hearing or seeing none, all in favor? Aye. Opposed? Motion passes unanimously. Thank you. It's a lot. And we still, I mean, we're past our time now, but we do have some time before our next meeting if we want to do some committee reports, which I had to skip last meeting, so I would suggest that we do. Start with Commissioner White here with the Active Living Steering Committee.
Yes, the Active Living Steering Committee, well, the weather pretty much really helps promote active living. Somewhere down the road, of course, in the future, we're going to be needing a lot more sidewalks from the housing developments, and so that's a real consideration. The Gitchigami Trail is getting repaired in places from the last time around when we had quite the rain. A porta potty in one or more places has been helpful in reducing the amount of refuse on the trail. So, and active living, it always continues. This county likes to move. The AEOA, we will be meeting, nothing extraordinary that has transpired with AEOA. And the Arrowhead Health Alliance, they are meeting next month in October.
Okay.
And I have been playing phone tag with Rick to just make a connection for the last 5 days or something like that.
Oh, okay. Okay, thank you. Commissioner Johnson, ARC.
Our next meeting is International Falls on Friday, but the July report, probation report, I just wanted to highlight, we had some entries and removals every month but there was more entries this time than removals as far as our caseload through July of 2024. I don't have the August one yet. But we're ending with 78 people on probation. The majority of the probation cases involve DWIs, assault, both domestic and against family. And I just want to highlight of all the major concerns as far as what is causing people to get onto probation. Those are the top 3 things, quite substantially. So I just want to point that out when we're talking about the needs of our community, addressing substance misuse and behavioral issues. It's proven in our probation reports. So that's all I have to report from that.
Thank you. Child Care Solutions Subcommittee, Commissioner Storley.
We will meet next month.
You, Community Health Board, I don't think I have anything to report. Frank, do you want to say?
I'd like to add a little something.
Yes, please.
So the last Community Health Board meeting was all cannabis all the time, and I think I mentioned that at the last meeting. However, I've been in touch with the director. We have an opportunity here, which we did not have with vaping, and that is we know that community sale of cannabis products is coming, and I know that the board has done a lot, the commission has done a lot as far as the legal ordinance goes. However, we have a unique opportunity now to get ahead of the curve and address public health concerns, especially with regard to underage purchases. I mentioned that to the director of CHB, and Allison, she suggested that Jenna Olson, our community health educator, would contact me. She has not yet, but I will do that. I strongly recommend that we get a campaign underway before it comes, not trying to play catch-up later. And again, not just an article or something like that, but a full-blown campaign, because that is coming. It's going to be a long-term issue. And if you can reach 8th graders and middle school children and high schoolers, and even the 18 to 21-year-old group, with appropriate messages, not preaching, but something that will set the emotional context of, oh, wow, is that cool, or is that a yuck? Okay? The emotions are where we have to be looking at, not just, setting out the public health scientific facts. So I strongly recommend we get on that before it happens. Thank you.
Thank you.
And that was also discussed at the last advisory council meeting, so we can skip that update.
Okay, yeah, awesome.
And if I may add that this afternoon, our local prevention coalition is meeting with a focus on cannabis, and both our Public Health and Human Services Advisory Council and local mental health advisory councils were invited to be a part of that discussion.
And I follow national trends on this issue, and it's really interesting to see that alcohol sales are down, cannabis sales are up, cannabis use is up, except with teens, it's down, which is like a head scratcher with stereotypes and, the concerns that we all share. It's just a really interesting dynamic here. So probation is up, out-of-home placements are down, there's all kinds of things to be following here. It's just, it's fascinating, all the dynamics. So thank you for sharing that. And thank you, Allison, for sharing that too. Moving on to the local mental health advisory council. Rana?
Well, I think most of what we talked about was already repeated again here, talking about a lot of the same issues, so unless I missed something, but
Okay.
preparing for this meeting and talking about the staff, and is that accurate, do you think?
One thing I'd mention
Yeah.
that came up at the meeting that hasn't come up yet this morning is that we now have a billboard on the east side of
Oh, yeah.
town. That Be There campaign, which is a regional effort led by Jenna with the Community Health Board, with a lot of support from our public health team. So it's exciting to see that 988 and Be There messaging on the east side of town.
Thank you. And restorative justice, Commissioner Johnson.
That meeting is tomorrow. I wasn't able to attend the last meeting, but I know Attorney Hicken is, but there are a couple items that I do want to highlight from. They're looking to get the word out about restorative justice. So if you are a member of a church or a community club or something that is willing to have a presentation from the restorative justice group, they would love to come to you and tell you about restorative justice. And that because we're looking for more circle participants, and training will be in sometime in January. It hasn't been set yet, but in anticipation of needing more volunteers. Put that word out there if you are willing to host or provide a venue for them to talk about restorative justice. You can reach out and we can set that up. And I'll turn it over to Attorney Hicken to tell us what transpired at the last meeting that I missed.
Sure. I'm not sure if the board was updated about the recent hires that RJ made. So there's now a circle keeper coordinator. Her name is Rachel Clark. And there is a restorative justice coordinator, and his name is Steve Borud. That name might be familiar
Stranger, huh?
too. So where RJ is really fortunate to have him officially part of the effort. And because he, in a lot of ways, restorative justice in Cook County was his brainchild 10, 15 years ago or earlier. So those are positive movements for the restorative justice effort. The other thing that's happening is that North Shore Healthcare Foundation is encouraging restorative justice to go forth and become its own nonprofit agency. You know, the Healthcare Foundation sees itself as a, what do they call it, a starter or
Incubator?
Incubator, thank you, an incubator organization. And, you know, the Cook County, Minnesota Restorative Justice is now maturing as an organization and is ready to do that. And so they're going to branch out and become an independent nonprofit. And I think that the timeline for that is maybe out 6 months or so. They're still planning. So they were talking about a new name that might be more inclusive. There have been discussions about joining up with Lake County restorative justice efforts, which are more in their infancy. And they've decided to kind of hold off on that for now and just focus on establishing the nonprofit with the original mission of serving Cook County. But again, with a name that's broad enough that perhaps in the future we can join efforts with other North Shore communities, which I think is a good idea, but I'm just one member of the advisory council. Anything else? I just want to highlight the efforts of Shelley Starkey, who is the restorative justice truancy worker. So our local restorative justice program took on truancy, or the assisting the government agencies, the school and the county, with truancy in the last couple years. And Shelley is the employee who does that. And she really has a heart for this work and has made an influence, has positively influenced a lot of different students, doing more for those kids and families than the county or the school can do with our resource limitations, and also just with the relationship that we have. We have a different relationship with students. Ours from the county attorney's office is more like the enforcer, and the school has more of an educator influence, and she's like pure support. Let's figure out how to get you to school. Let's get to some of those underlying issues that are keeping you from making it. So I think the county leadership should be pretty grateful that, she's involved and restorative justice is involved in truancy, because I think that has the real potential to reduce the problems we have with truancy over time. And common sense and maybe research, I haven't looked at it, inform us that if a kid goes from truant to going to school and getting their high school diploma, you're giving them a much greater chance at success in the future and reducing the chances that they're going to require our services in corrections or prosecution or even in social services if they're supported in those early years to be successful in school. So yeah, I love restorative justice. I could go on, but that's enough.
Excellent. Thank you. Move on to Council on Aging. Commissioner White.
The Council on Aging, excuse me, is very interested in having a conversation. I had a random conversation with Frank in the grocery store the other day, and so at some point I would hope that everybody gets to sit at the same table and have a talk about helping financially with the hub, and what firsthand from those board members who have done it, who have done an incredible job over the last couple of years, and Commissioner Sullivan was there from the start of that change. And it is an organization that is vital to this community, though much of the community is unaware of it. So.
Allison?
Just a comment on that topic as a follow-up to our last meeting, Commissioner White, Grace with our public health team has started looking into facilitators that might be able to convene a conversation around long-range planning, and that this could align with some of the age-friendly work that we're doing in partnership with Care Partners. So there's some momentum there, and we'll certainly keep you all informed as that moves forward.
Thank you. Emergency Preparedness Committee, Commissioner Sullivan.
Thank you. Well, I imagine most people have seen in social media that our Emergency Management Director, Mike Keyport, has put out a press release trying to get public input for the Cook County updating of our hazard mitigation plan. And so they're looking for county residents, county community leaders, business owners, other area agencies, and organizations to share how severe weather impacts their property and lives, and to share ideas on how to reduce local impacts. So this is a plan that is updated every 5 years, and Mike has been in his position for 5 years now, so it's time to go forward with this. But the plan will assess the natural hazards that we have in Cook County, like tornadoes, straight-line winds, ice storms, blizzards, wildfire, flooding, and even extreme temperatures, and talk about how to minimize damage in future events. So again, we're looking for input from the public and organizations. And some of this hazard mitigation plan might include things like stormwater management, which we're already engaged in with soil and water, removing existing buildings if they're in flood or erosion-prone areas, increasing defensible spaces around homes like we do with Firewise, and hard to think about it here in Cook County, but constructing tornado-safe rooms in vulnerable areas. And I think about the trailer park that is close to my residence and also is in District 4 as being an area where we might consider that. Bearing overhead power lines, which Arrowhead has been doing for a long time. So not necessarily anything new, but increasing our efforts to make sure that we're prepared to deal with those types of countywide emergencies.
Thank you. Healthcare Planning Committee, Commissioner Storley.
We did not meet, but I'll go right into the next topic, which I'm not going to report much on, other than mental health is a concern all across the country. And I just came off of Association of Minnesota Counties, attending the Health Committee. And I can't report on 7 hours of work, but I'll give some highlights. Lots of discussions on technology modernization, which we're already talking about here, workforce recruitment, retention, training, restoring funding for cannabis future needs that we're going to be talking about. So basically we broke up into groups, and I attended the topic of training, availability of training. There are some folks in the metro area that have to travel to Duluth for on-board training. There's not available from the state for any kind of Zoom training, or they have to go to Marshall. And so, we really need to look into how people can have training when they're just beginning, rather than to have all this travel that they have to do. So a quicker response online, and recognize the past training of new employees so that they come in, they're recruited, and then they have to start all over again for a refresher course, which could take up to 2 to 3, 4 months. So some past training recognition there. And so, we voted on all of that. That's coming up then in December. So all of these are going to be submitted to AMC. So when we have this committee meeting, we already have 2 or 3 AMC employers right there. And so they're going to put all this into a need and categorize what was the most important, which is hard because they're all important.
Mm-hmm.
But before we ended our meeting, Commissioner Cassidy from Rochester said that she's really tired of us wringing our hands and talking about mental health and the fact that our systems are failing. Our residential treatment beds, are just not there for folks. They're being housed in jails and in centers that are not appropriate, emergency rooms and all of that. So I'm just bringing this up as this is a proposition, or she actually put it into a resolution. I'm not going to read it all, but the idea is that AMC will be the umbrella to support a working group that will consist of commissioners, tribal involvement, local public health associations, county attorneys, sheriff's association, and we come together to talk about how that we can work and present this to our legislature. Because we're not getting through to them. They're not understanding, or maybe they're understanding, but, they don't seem to want to have it as a priority. So we passed it, and it's on then to AMC plate to consider. They would not conduct it, but there would be an outside source coordinator that would bring all of us together, whoever wants to have time to go on to this type of identifying these solutions. And really nothing can be done because we don't know who's going to be selected for our new representatives and senators. That's a big factor, but we will know if AMC will take this on by the time we go to St. Paul for the legislative session, which would be end of February, first part of March. But anyway, we thank Sheila for this because it is frustrating to hear from all over the state the same thing that we all encounter. So it's a good piece of news in a way, and it's encouraging that at least somebody has said we're tired of it. We need to move forward and have some solutions identified. And that's it.
Thank you. Yeah, Frank?
I wonder if it would be possible, between the November election and the opening of the legislative session in February, to contact the new or returning legislators before they get there. Because when they get there, they're going to be distracted by a bunch of other things. Meanwhile, they have a couple of months, you got a couple of month window to get first on their list, to get right in the front of their brain.
Right.
So just a suggestion, think about it.
Point. Anything from NACO you wanted to report on, Commissioner Storley?
No, other
Okay.
than it's an ongoing discussion there too.
Yep,
Mental health.
yep. Then we've got Northeast Office and Job Training, Commissioner Johnson.
And that meeting's next week, but I don't know if you've all heard that Commissioner Ives passed away on the 11th, and so I will really miss his input. He had a lot of experience on that board that I relied on him for, to give a different perspective than I have, so.
Thank you.
I
Yes.
do have one other thing that I would like to report from Extension that just got sent, and I'm sure Commissioner Storley, I'm not sure if it went out to all the commissioners, but there's a COMET training. Now, when I saw that word, I'm thinking, that's a word that I've heard in other places that I didn't. Anyway, there's a COMET training, which is changing our mental and emotional trajectory, whatever.
Trajectory?
That's it. And on the 19th or the 20th down in Cloquet. Now, I can't attend, but I went to the website saying, oh, that's interesting. And they're holding these at different areas through Extension. But there's also an online webinar option, like sometime in October. So I just think that should be promoted in our community. We have Extension resources that are available to us that we can get, and there was no cost for the free webinar, so,
Awesome.
that I could see. I didn't sign up because I don't know my schedule yet, but anyway, that, just for information, that should be promoted through Extension, that these services are available.
That could be good for public health, too. Please, Allison.
Thank you, Commissioner. We have been promoting that within our team and our staff newsletter, but we'll absolutely take note and include that in some of our social media outreach as well
That's
within the
fantastic.
broader
Would be
community.
helpful.
Thank you.
And I'm on for the North Shore Collaborative, nothing to share there. And then the Public Health Human Services Advisory Council, Frank, I think.
Yeah,
covered
just one other thing. There is a invitation out, waiting confirmation from the CDC, new director of the new Office of Rural Health, to address the Community Health Board on our October 21st meeting, and that will be a big tent. We'll also be inviting the Cook County Advisory Council, the Mental Health Council, members of the Public Health Board. You all come. It's going to be a Zoom briefing on the resources that are available through this newly opened Office of Rural Public Health. And I think that focus office is coming through, the focus group is coming from the Rural Health Institute, which also has a close association with it. So I just wanted to let you know, you may be getting an invitation to an October 21st briefing.
Nice, thank you. Then we have the good of the order, which I'm going to pass. Future meetings, we have the September 27th, 9 to 3, Human Services Leadership Forum in Grand Portage. I'm planning on attending. I hope all are aiming for it, but I know not all can. And then last item is adjournment. So we are adjourned. Thank you.
Thank you.
Thank you.
What was your last thing about Grand Portage?
What was the last thing?
That you just said you wanted.
Yep, it's the Human Services Leadership Forum.
Yeah.
Yep, that's